Thank you very much, Raja. So I do have a lot to say, but I only have 5 minutes, so I won't say it all.
You can take more time. It's okay. We still have about 50 minutes.
Okay, perfect. So I'm going to speak specifically for the area of cancer. You might have noticed already that cancer is extremely high on the political agenda right now at the EU level. So we've got the EU Beating Cancer Plan to be launched early next year, if not end of this year. But the way the timetable is going, I think they've got so much going on that it won't be launched until earlier next year. You've got the Cancer Mission Board, regarding research that was put together earlier this year. And all this is really in response to the magnitude of this disease, right? We've got 3.5 million people diagnosed with cancer every year. 1.3 million die from it, and we're not even talking about the family members and the friends who were affected by the diagnosis of and the deaths of the cancer patients. So, but what is not as well known is that as much as 50% of cancer cases are preventable. So with proper lifestyles and early detection. And this is why AI is so important now, because the early detection of cancer, which includes early diagnosis and screening, can really significantly increase the chance of treatment. So when we're talking about early diagnosis, we're actually referring to the awareness of the first signs of cancer. And we see that AI is really playing an increasingly important role in the area of early diagnosis. So we're talking about, especially in the areas of breast cancer, skin cancers, and specifically, most importantly, for the professions of radiology, pathology, dermatology, where you're talking about banks of images, right? So when we're talking about the data that is being fed into it, so it's especially helpful for these professions. And the field is moving quite fast. Last year, the Food and Drug Administration in the US approved the first AI-based software to process images rapidly and assess radiologists in detecting breast cancer and screening and in screening mammograms. So that's, we still got a ways to go there. Now, when we're talking, it was very interesting seeing, because I wasn't in the group, but reading about the 7 key requirements for trustworthy AI, really, really interesting. But I also find that they're so interlinked that it's hard to talk about one area separately. So for example, if we look at the first one, talking about human agency and oversight, where we say that AI systems should empower human beings. But what if it's not always the case? Then accountability then also falls into this category, doesn't it? So if we look at just this category, human agency and oversight, people tend to think that machines are perfect and, okay, but the machine, the Excel sheet calculated this equation, and so it has to be right. But, they're only as perfect as the people who design the algorithms and the programs. And what's interesting is that if you Google AI and cancer or AI diagnosis and cancer, the first results that come up, will AI replace pathologists? Can AI replace nurses? What jobs will AI replace? Will AI replace dermatologists? So, these are the areas some of the areas I was mentioning that AI is very strong in. So people are actually quite concerned that, they would lose their jobs or they would, lose that human touch. Already, we see that with banks, right? If I go to my bank and I want to withdraw money, I do it from a machine, it's free. But if I go to see a person, I will get charged for that service. So, people are starting to get nervous. Oh, what's going to happen? I won't be able to see my doctor anymore. Now, I think in times of COVID, patients are getting actually more used to this because, we can no longer as comfortably see our physicians face to face. So they're getting more used to doing it remotely. But anyway, going back to human oversight, why is it so important? So I want to show you an example. I'm going to see if I can share my screen here. And if it's problematic, just a second. Bear with me here.
Yes,
So
we see your
can you
screen.
see my screen? Yes.
Yes.
Okay, so this is about the, just a second. I don't know how to get rid of this preview.
Because you are in presenter mode, leave the
Okay,
slide.
I'll leave it. But so the first slide actually shows the European Code Against Cancer, which talks about how you can prevent cancer. So I'm not going to go into that too much. But if you go to cancercode.eu, it shows the 12 messages that are easily adaptable by people, by just general people like you and me, that, you know, to prevent 50% of cancer. So, but the example I want to show here is, I don't know how many of you are familiar with Quick Draw. So Google Quick Draw, what it does is it works with neural pathways, right? Neural data. And so it's asked people to go in and it will say, draw an apple. So this is what it shows, drawing an apple. And so it's really an experiment, because then it will show that if somebody draws a circle, they will say, oh, that's not an apple. So it's actually teaching Google how to recognize what is an apple. But then you also have something like this. It says, draw a line. And then what is this? You know, you have some anomalies there. So basically, the reason why I'm showing you that is the same thing when we're talking about diagnosis and looking at images. These are skin lesions. Okay, so if you're feeding these images into an algorithm, into a database, it might be able to tell you what is malignant and what is benign. However, what if you fed, you know, if you're a new dermatologist and you're feeding in information that is not absolutely correct, then that would also mean that the machine would not be picking that up as properly as well. So I think, you know, there are many dangers here, and I think we have to be aware of that. I want to see how I can stop sharing my screen now, and it's not letting me. Sorry about this.
Yeah, there is.
Is somebody able to help me stop sharing my screen?
Yes.
Okay, great. So my point there was that, you know, it's as robust as the people who feed into it. So I think the professionals don't really have anything to worry about. So algorithms have to crunch data, but then, you know, you have the subtle judgment-based skills of nurses and doctors that cannot be digitalized. So we definitely need the healthcare professions to be part of that so human oversight will always be necessary, and at the very minimum, needing the human expertise and the interaction. I want to go into privacy and data governance, because Raja, you mentioned earlier, you know, about privacy and data governance and GDPR, which is only in Europe. But in Europe, you know, we like GDPR in the broad sense of the word, but then the problem is the interpretation of GDPR at the country levels. They vary from country to country, and this is really a problem for researchers, because can cancer researchers use the data afterwards, or do they need to go back and, you know, different countries have different interpretation. Some feel that they need to go and find the patients and get their permission to use the data 5 years later on, and then some think that it's not the case. So I think there needs to be some clarification there. And then regarding the patients, especially for cancer patients, the privacy and data governance is so important, because now these days cancer patients are discriminated against, even years after their diagnosis. They're discriminated against when they apply for a job, because the employer thinks, okay, what if it comes back? I'm not sure whether I want to hire you. You're going to take time off, or you'll quit altogether. They're discriminated against by the banking sector, because they won't be able to get a loan as easily if they want to buy a house or buy a car. Insurance, health insurance, that's a big obvious area that they're discriminated against. So patients need to be part of the process of looking into privacy and data governance and getting their opinions into place to make sure that there's something that they're comfortable with when we're sharing their data. When we're talking about transparency, in the paper, we mentioned chatbots, and absolutely, you know, patients need to know if they're going to be getting advice. Are they getting advice from a chatbot, or are they getting advice from a real person? Cancer, when, you know, somebody's diagnosed with cancer, it just really hits you in the gut. And can you imagine that you're talking to a chatbot, and then it's just giving you generic responses? That just adds insult to injury. So, you know, transparency plays a very, very important role here when we're talking about cancer. And then lastly, I want to talk about accountability. So we talk about making sure that mechanisms to be put in place to make sure that the responsibility and accountability for AI systems are there, and their outcome. And, you know, we now, Raja, you were talking about education. And I think that is part of the accountability. I think we all need to be educated, not just the general public and not just the healthcare professionals, but, you know, they need to, so at the medical, when you're a medical student, I think it needs to be part of the curriculum for the medical students to understand exactly what is the role of AI, what their accountabilities would be, what is the role of accountability, what if there's a wrong diagnosis, who is responsible for the wrong diagnosis? Is it the company that has developed the algorithm, that has developed the machine? Or is it the healthcare providers who are feeding information into, or is it the hospital that is providing this to facilitate the diagnosis for the healthcare professionals? So it's all there. It's also linked to health literacy, AI literacy. So we really need to help the society understand what AI means for them, and what the accountability, where that falls in when they're diagnosed with not just with getting cancer, but any kind of disease here. I can go on, but I think I used up my 5 minutes, Raja.
Yes. Well, Wendy, we were listening and not counting the time, actually. Thank you very much, because you brought this global view on the key requirements, and actually, indeed, you identified how much they are intertwined and related to each other. And this is really important, because it's not that sometimes one could be maybe in tension with the other. It's even more complex than that. It's that one leads to the other. So let me remind the attendees that they can ask questions in the Q&A window. And now I'd like to move to our next speaker, who is Ben MacArthur, Deputy Program Director for Health and Medical Sciences at the Alan Turing Institute. Ben?
Yes, good morning.